most rewarding about your field?
Probably my capability to not only care for patients, but fix them if they're broken. So I like having kind of the full armamentarium, not only to care for people, but care for them non-surgically. But if they need something surgically repaired or corrected, I have that opportunity as well.
Yeah, that's awesome. Do you also enjoy having the immediate kind of action-oriented approach to treating patients? You know, because as a surgeon, you know, you're obviously, that's basically your job to treat the thing immediately, versus, you know, on the more medical side, it would be a lot of figuring stuff out before taking any action. But is that part, would you say that's also part of what you find rewarding?
Definitely. Yeah. I'm definitely more of a kind of a problem solver, put it together kind of person. And definitely I like being able to tell someone this is torn or broken and I can fix it.
Awesome.
Yeah.
And what do you find most stressful about your field?
You know, I think that the risks involved with operating on somebody, you know, complications, even though knock on wood, they're typically very rare, but just the fact that I'm trying to help somebody and you could, you know, even though it's a very, very small percentage, there's a small percentage of people that you could end up harming. And that's certainly very stressful and, you know, always in the back of my mind.
Yeah. And how do you deal with that stress?
That's a good question. So I deal with that with good preparation, you know, making sure that whoever you're going to be offering or indicating for a procedure that it's appropriate, and also trying to mitigate or minimize any risks, being aware of people's comorbidities, their past medical history and things like that. You always have to be aware of those things so that you're not taking on unnecessary risk.
Mm-hmm. Yeah, for sure.
Fortunately, I think my general stress level is very low. At this point, I've been doing this for about 20 years. So I have a pretty steady practice and I'm pretty comfortable with everything that I do. I exercise, you know, I try and take care of myself. That helps my mental well-being and my physical well-being. And I think that keeps me, you know, hopefully in good shape so that I can take care of my patients at an optimum level as well. I'm actually Jewish. You know, I think that, you know, my upbringing and my family tends to believe in just positivity and, you know, taking, and family is very, very important. Trying to, you know, do the right thing. And even though it sounds simple, sometimes that can be hard. I have 3 boys. And so, you know, taking care of them and teaching them is also part of that belief system. So I think that it can be very helpful from a family standpoint as well.
Awesome. Yeah. And about that, regarding family, how much time do you think your field allows for, you know, a good work-life balance? Do you feel like you have, you know, enough time to dedicate to, you know, both, you know, things outside of work and things you're responsible for outside of that?
Yeah, that again, very good. That's very, very important. You know, I think that's changed over the last few decades. I think that you know, kind of one of the knocks on being a doctor was that K always comes first and that family comes second and you're not going to be around for your kids and that kind of thing. I've been very fortunate, I think, specifically within the surgical world. You know, I specialize in sports injuries and arthritis. So I've been very fortunate to establish a practice that's mainly elective. So I don't really take call. Everything I do is pretty much scheduled. And so, you know, I'm typically home every day after 5 o'clock at the latest. Fridays, I only work until lunch and I don't take call on weekends or anything like that. So I would say my work-life balance has been fantastic. That's
awesome. Yeah.
Mm-hmm.
And what would you say is your favorite part? Like, do you have like a favorite kind of surgical procedure or any aspect of your field that you find like as a favorite that you'd consider as a favorite?
Yeah, I mean, probably generally speaking, shoulder work. So arthroscopic surgery on shoulders, I've always enjoyed. It's kind of like a video game. I mean, you know, really have to be very hand-eye coordination, and you know, there's certain techniques you have to be good at to be able to get things done efficiently and effectively. I've always enjoyed that. But I do enjoy it all. I mean, I do a lot of joint replacement surgery. That's also that's an open procedure. That's not arthroscopic, but that's also, you know, a lot based on physics and math and, angles, and you have to be, very adept at that. So I enjoy that as well.